Hi guys, Donovan Gow here. I'm exactly 6 weeks to the day after ACL reconstruction surgery on my right knee here, and I used the hamstring graft option. Recovery's gone really well, so I thought I would share with you what I learned along the way, some things I wish I had known going into it, and hopefully you can have a speedy recovery as well. So first I'd like to just talk about the day of surgery and what to expect. I'm a nurse, I work in a hospital, and I still didn't really know what to expect on the day of surgery. So going in, you're going to not eat, obviously, before the surgery, usually from about midnight the night beforehand. So if you can, an early morning surgery certainly is better. You won't have to go so long without eating. I'd certainly recommend having a good meal the night before and really hydrating well, because you're going to go a long time without any real food or fluids. They will give you IV fluids when you get there. But so you check in the morning. Nurse will take you through a pre-op checklist and all the intake forms. Usually you have to show up about an hour or so beforehand, maybe a little more, depending on your hospital. And that all is pretty smooth. They'll clip the area usually around where they're going to do the surgery. The surgeon usually comes in and goes over everything with you, make sure he's got the right knee to work on, so make sure he checks that. These mistakes do happen. Then they'll put an IV in you, and one of the concerns I had going in was the last time I had general anesthetic. It really freaked me out. I hated it. And this time they'll give you usually a light sedative through the IV beforehand. So it's none of that experience of going into the operating room still awake and really with it. The anesthesiologist will start working with you even before you're in there. So as far as my recollection, they put the IV in, start running the meds, and I was out. Next thing you know, I'm waking up. The whole procedure itself took about an hour and a half. And then you've got another probably hour and a half or so in recovery, in the PACU it's called, as you're kind of getting back to your full senses, and they make sure your recovery is going well. One thing I would recommend then, there'll be a nurse there, they'll be asking you if you're having pain at all, and don't be a tough guy then. If you're having pain, let her know. They can give you some pretty strong stuff while you're in the hospital, usually fentanyl, something like that. You want to control that pain early on. And also nausea. Real common to have nausea if you're having general anesthesia. And if you're having any at all or think you may, ask for something for nausea before they send you home. Because they'll give you oral medications for nausea usually. But obviously if you're throwing up or feeling really bad, it's hard to get oral medications down. So if you can get some IV medications before they pull that IV, that's a good sign. I did not do that. And then I spent the next couple hours feeling pretty nauseous until the oral meds kicked in. You're definitely going to need someone to take you home, and you're going to be pretty out of it. They'll give you, usually, in my case, they gave me a full leg brace to be in. So the leg is locked. You'll get braces, and you'll get something like it's called a polar cooler. It looks like a little igloo cooler that pumps ice water, which you're going to keep on that leg constantly, or pretty much, per your doctor's orders, to keep the swelling down, which is a big issue in the first few days after surgery. So you're definitely going to want someone to take you home. I'd recommend having everything set up for when you get home. Have your bed ready, have whatever you need right there. You're not going to want to move hardly at all or mess around that afternoon or that evening. I would also make sure you've got ice handy, because you're going to need it. You're going to be icing a lot. And if you run out of ice, or someone has to go run for it, that's a real pain right after surgery. You're also probably going to be getting meds on the way home, so be prepared for that. You're going to get your prescriptions, and think about how you're going to get those and get those picked up for when you get home. Then final thought, just for the day of surgery, is pain management. Now, I'm not a big fan of pain medications. I try to get out. I don't use them hardly at all. But from my experience as a nurse, what I've seen a lot of patients go through, if you try to be a real tough guy and let the pain get ahead of you, it is really hard to catch up. post-operatively. You want to stay on top of that pain medication cycle, very diligently. You probably will get a nerve block, and that'll control the pain on the front of the leg pretty well up front, but that'll wear off sometime, usually kind of in the middle of the night. So if whatever they prescribe you, you definitely want to use those medications early on to control that pain, or else you're going to have a pretty miserable first few days. So that's my experience for the first day. I'll put more up about my experience in the weeks after that, and what worked, what didn't work, and what helped me recover quickly. So I hope you learned something and found something useful. Please check out my Facebook page, which I talk about a lot of my health and wellness ideas on there. And thank you for listening.